that social distancing seems to be working here in the U.S. Experts continue to warn us, though, that this pandemic is far from over. So to talk more about where we are right now in this, let's bring in Dr. Bob Lahita. Doctor, we mentioned earlier that some states are very eager to reopen. And quite frankly, some states are seeing much lower numbers, certainly than, New York is seeing, New York being the epicenter. But without a lack of widespread testing, even with lower coronavirus positives, is it a good time to consider reopening?
No, I am, around the New York City area, everyone is so overworked and have seen so much death and so many ICU admissions. We are basically wishing or hoping that mitigation continues with regard to masks and with regard to distancing, because there seems to have a plateau now of ICU cases. There seems to be less admissions, and we are discharging more people, but we're very, very cautious. And I'm concerned that if we let up our guard, we're going to have another surge. So just around the New York area, New York, New Jersey, and perhaps lower Connecticut, we're seeing a bit of a problem coming with phase one. We will try to maintain the 2-week status, so we will see where we are, and maybe we can eventually go to phase two. The critical part here is the testing. We need to have testing because we need to do surveillance on susceptible populations, nursing homes, people who are in close contact with each other at work. We send people to work, they have to ride buses and subways and all that. So we're very, very concerned about that. And I think we're going to be in phase one for a while here in the Northeast.
So, Doctor, somebody who's struggling to understand what this virus does and what it can do and what the implications are going forward, I want to ask you a couple of questions about this. As an expert in autoimmune diseases, the concern that I'm guessing you have right now is if we ease restrictions, we could see a resurgence of COVID-19. I wonder, given that and the fact that we really don't even know if people who have been infected with COVID-19 and survive are not able to be reinfected again. I mean, I understand that there are some diseases like the measles or the chicken pox that once you survive that, once you get through that, you're good for the rest of your life normally. But do we know yet how long antibodies to COVID-19 remain in the body and how they prevent reinfection?
No, but we can make a prediction. The issue here is that the common cold, which we all know, is usually driven by either a rhinovirus or a coronavirus. Now, you can get a cold several times, so your immunity to the cold or the coronavirus for the upper respiratory infection is quite limited. I'm worried, we as immunologists are all worried that the coronavirus 19 is very similar, so that your immunity, while it will be a bump immediately, may not last 6 months to a year. And you may be capable of being reinfected. That is the fear. So COVID-19 is a fastidious virus, but it's very much like the other coronas in the family of coronaviruses, the RNA single-stranded viruses. So everybody's got to worry about that. And a vaccine, while it's important and it will be a great boom to us, as well as will testing for antibody, I'm not so sure the kind of immunity we're looking for we can ensure.
So I want to ask you about treatment, because it appears that is what's so frustrating. Partially what's so frustrating about COVID-19 is, yes, we don't have herd immunity. Yes, we don't have a vaccine. But it also seems, from an outsider's point of view, like the treatments are almost sort of guesswork. People go on ventilators, they're on ventilators for weeks, and they could still die. And so now we're hearing about another experimental drug. It's called remdesivir. Hopefully I'm saying it properly. It seems like it's offering some relief. Can you tell us more about this?
Yes, remdesivir is an antiviral. It's related to the kind of drugs that we used in the HIV epidemic of several years ago. Remdesivir, one has to be a research center to get the drug. It was on about a month ago offered on a compassionate basis, but the demand is so high that you have to have a research protocol for it. We have that research protocol at St. Joe's, and we are now using remdesivir to treat certain patients. It seems to be quite effective, but it is effective in those patients who are quite ill. And this is very, very important. The big problem we have here, and this is kind of a paradox, is that the immune system seems to be what is killing our patients. That when your immune system is tickled to death, literally, the cells of the immune system are hyperactive, and the patients die of something called cytokine storm. And the cytokines are a communication molecule, and the remdesivir seems to interfere with replication or division of the virus within the cells, much like the drugs for HIV. So it's a very useful drug, but it's not available to everybody.
Doctor, I want to ask you also about testing. The United States is lagging other countries in testing. And I wonder, as government officials, certain governors, even the President of the United States talk about the prospect of flattening this curve, doesn't that mean, though, for us to contain this pandemic and for us to get out of where we are right now, that we need to do more testing and not less?
Yes, absolutely. Everybody in healthcare should be tested and tested over and over again, because one of the fears that all of our nurses, our cleaners, our ancillary personnel, my residents, the medical students, everyone wants to know whether they've been infected and are immune. Because, among a big population of OBGYN cases, women who are pregnant, it was found in one study that 1/3 of them had the infection and didn't even know it. They were asymptomatic. During pregnancy, the immune system is very special and protects the pregnant mother for the most part. There are a few cases that are outside of the norm. But so testing is critical. We need to know whether we were recently infected, or we need to know whether we were infected and we have now recovered and we have antibody. We can look at the antibodies in the test. We do this all the time for other diseases, and we can tell whether you've been recently infected or you've been infected in the past. And that will be extremely helpful for everybody concerned.
So, Doctor, real quick before you go, in your estimation, in your expertise, what needs to be done? What needs to happen in the United States for us to say collectively as a country, we are out of the woods, we can start to return to some semblance, not completely normal, but some semblance of normalcy?
Well, first of all, we're hoping that the virus is sick, just like the flu. So it may be attenuated in the summer months. But I'm looking at Africa and South America, Latin America, where it is warm and the virus is raging. So that may be wishful thinking. What we need to do is get widespread immunologic testing to find out who is infected, who's been infected, who's recovered, and find out if there are people out there that are asymptomatic, but yet are infected and capable of transmitting the virus. So that's the reason for mitigation, and the reason that people need to continue to wear the masks, to act as though the virus is everywhere, in the supermarket, in the department store, etc. Once we understand who's infected, who's immune, who's not immune, we can move forward. We can go to restaurants again. We can go to the theater and to the movies. So I think the future looks very bright. And then think about this. We have a vaccine coming, which I hope is going to work. We'll have a vaccine in the winter months, early spring of next year, which will be very effective, I hope.
All right, Dr. Lahita, thank you very much. Really important information there. We so appreciate it. Thank you.
Thank you.